my pleasure to introduce the next speaker. Leanne Kant is a speech-language pathologist and lead trainer at the Aphasia Institute. She also works as part of the clinical speech-language pathology team, conducting assessments and providing programming according to the life participation approach to aphasia model. Leanne has worked in a variety of hospital settings, including adult inpatient and outpatient rehabilitation, continuing care, and private practice. She provides on and off-site trainings and is a strong supporter of communicative access in healthcare. Please welcome Leanne.
Thank you. All right, I'm going to get my slide deck up. All right. All good?
Looks good.
Okay. So first of all, thank you very much for the introduction, and thank you for having me speak with you today about aphasia and the return to home transition. I'd also like to just have a shout out to Jeanette, who warmed the audience up for me in terms of showing aphasia-friendly information. And some of the pictures from the Aphasia Institute were part of that. So thank you very much. I'd like to suggest that returning home after stroke and aphasia is a new conversation on many levels. It's a new conversation for the person and their family, and I'm proposing that we need to have some new conversations in terms of helping people transition well in the most supportive way for good health and well-being outcomes. So these are my disclosures. The Aphasia Institute receives an honorarium for this presentation, and there are no relevant non-financials to disclose. So I work at the Aphasia Institute in Toronto, as we've said, which is a community of people with aphasia, staff, volunteers, who really work to build on these two big pillars of what we do. One is our mission in terms of nurturing hope for people with aphasia and their families in the way that we develop and share innovative solutions to language barriers and full participation in life. And you can see at the bottom of the mission side, we have this idea that initially the aphasia seems so big. It's such a barrier for people. And our goal is to turn that kind of on its head and make life feel bigger than the aphasia and make aphasia seem survivable, and it is survivable. Our vision is that there are no barriers to living successfully with aphasia, and in doing this, we really need to look at, identify, and break down the barriers that we find in society, and particularly for today in healthcare. So this is just an idea what do we think about when people go home after stroke? We've been talking about these things today, and it has many challenges, but a lot of the important needs and concerns are on this slide in terms of, the instrumental daily activities of life, exercise programs, physical well-being and monitoring, and reactivation in many of these parts, and this is all really important. But I wonder, and my question for us today is, what is it like to go home after stroke with aphasia? And what do we need to think about in particular for these patients, for these clients? So some of the ideas here on the slide, you can see being able to understand and engage in their medical care, having safety at home, being able to call for help, or living alone and being safe, even though you have a communication barrier. Returning to roles in life. We are having so many younger strokes, and I'm sure you are as well. So the role of being a parent, being a friend, how they manage meaningful activities, return to meaningful activities. You can see there one of our members in blue volunteering at a food bank. And also how they sustain relationships despite the aphasia. So my goal here today is really to explore these needs with you and hope to provide some possibilities, some practical tools that you can use in the lives of your patients and clients with aphasia and other communication difficulties. So our learning objectives today are to describe the impact of the aphasia for the person returning home, to explain basic SEA to be able to understand what it means to provide communication access, just like we provide physical access. And in terms of providing basic support to the conversation, supported conversation, it can help you provide access to your service for your patients and clients. And also to recognize the needs of people with aphasia and their families as they transition home, and to be able to grab 3 of the resources that I'm sharing with you, hopefully to support these needs. So I want to start with the video. We show a lot of videos when we train at the Aphasia Institute because these are real people and real stories. These are some of our members, and they are describing the impact of the aphasia on their lives. These members range from what we would consider mild aphasia, where you might not even notice that there's language communication difficulty, to very severe. They're all at least 3 years post, but we know aphasia is often a chronic condition, and we need to continue to support and treat along the continuum of care. So I want you to listen to the obvious result of having aphasia, which is the communication challenges, but also listen to the impact for people.
I know.
Could you please tell me your name?
Maybe name is Richard.
My name is Christine.
Now is.
It's okay.
It's okay. I know.
What's it like to live with aphasia? How would you describe it?
It's just incredibly sad to know that I can't be as smart as I used to be.
Here maybe is English and now not speaking. I know.
It's a one piece of information at a time. That makes it easier for you.
They didn't tell you is be prepared, it's going to be really hard.
Talk to me. That is here coming. I know.
So I imagine you can hear the struggle, you can hear the impact, the frustration, the plea to talk to me. And all of these members were young when they had their stroke, unable to return to work. So these are really huge impacts on people's lives. So I want to first turn us to defining the aphasia itself. Most people probably already know the definition, traditional definition, language problem related to damage in the language areas of the brain, and most often stroke related. You can see the pictures just to the right there in terms of difficulty talking, so getting their message across, getting their thoughts out, trouble understanding others, particularly if the conversation goes really fast, difficulty in reading, and difficulty with written language, so affecting the way that we text, the way that we email each other. And so what we've learned is that this traditional definition is fine, but it really doesn't describe the impact of the aphasia. The impact being that aphasia masks the inherent competence of the adult in front of you. These are intelligent adults with adult abilities, and the aphasia hides that. The most dramatic impact, I think, is on the ability to engage in conversation. And if we think about how conversation drives what we do every day, of much of who we are, It's how we go through our day, how we connect with others, how we accomplish meaningful tasks in the day. And so what happens is aphasia becomes a huge risk to all of the roles, all the activities and relationships that we hold, including the activities related to good stroke care. And I would say that it has the biggest impact as well on who people feel they are now, so their personal identity. And finally, for today, there's a real relevance to health equity issues. How you receive health services are different, potentially, than those who are, let's call them, language enabled. So when we think about return to home, I just want to go over some of the things that make it hard. So conversation is no longer structured when somebody goes home. Maybe in hospital, right? There's that kind of day-to-day rehab facilitated by staff kind of conversation. But when you go home, it's a big shock because it turns back to the complexities of life. Relationships and conversations at home are complex. We have to understand that conversation is the way that people, share their lives. It's the way that we argue with one another, we negotiate with one another, we problem solve. And it's hard to maintain relationships when the barrier is conversation. So frustration and grievance can grow, and often people with aphasia are left out of decision making, to be honest. People with aphasia and their families do want them to return and reprise their life roles and activities, but it's much harder. And I feel like families and friends and people in their lives really need guidance on how much support the person with aphasia needs linked to the various activities that they want to do. Responsibilities have drastically changed, right? Such as, finances in the family home, being able to drive, being able to work. And there is this aspect of burden for the close care partners, but also a loss of meaning and purpose and identity for the person with aphasia. And finally, social connections really depend on communication. So over time, it's just so hard to connect that a lot of times social relationships are lost or reduced over time. So it's a huge impact. And, when we think about even the first talk today, the keynote speaker talking about social isolation, it's even bigger with aphasia. Loneliness, depression, and anxiety are big pieces that develop. Loss of self-confidence, self-esteem, and reduced social interactions, as I've been talking about. So in the effects of that, in a lot of the literature too, we see this reduced cognitive function due to that lack of conversation, that lack of social stimulation. We see changes in interpersonal relationships and a reduced involvement in decision making. So this has been the bad news, the bad news part of my talk. But the key is that aphasia does not by itself cause these things. Aphasia results in these things because other people don't know how to support the conversation with someone with aphasia, and there are real barriers to a meaningful participation in life. So I'm going to come to the good news part because I want to describe a bit of a framework. You might have seen this before. It's called our framework for it's many minds went into developing this, but living well with aphasia, which is in the middle of this diagram, is our goal. And this can be the start of the good news because it has a real potential to guide people's thinking about where we need to be spending our energy. So the first domain I'm going to describe is the bottom one. It's the easiest. It's the impairment. It's the aphasia itself. And we hope it gets better, right? We want to support and treat how that gets better. But more interestingly, I guess, for the talk today is the other domains, because if we look at participation, what does it look like that people with aphasia are back doing things in their lives? How can we support that? How can we support the activities and the relationships that they want to stay strong in their life? Also, the communication and language environment. So that's people and that's written information as well. So healthcare workers are part of that environment. How do we support the conversation? How do our attitudes towards people with aphasia and the aphasia itself affect them? How do we provide written information that they can understand? And then you can see that all of these circles interact with one another. So, you know, when we take a closer look and a better look at participation in the environment, we have a good chance of improving the personal feelings and identity. So self-confidence and self-esteem and coping, and even a more hopeful outlook for, I'm going to survive this, I'm going to live well with aphasia. So just very quickly with the best practice, you know, in terms of rehab best practice, we've got evidence to say that this supported approach is what we need to be doing in terms of healthcare providers knowing this information and providing aphasia-friendly patient information, making sure families can speak to their people with aphasia through our services, and also just having a look at the impact of the aphasia on people's lives, on their actual participation in life. Second piece is I looked up the transitions in community participation following stroke and that best practice. And if you look at those areas, supporting people with stroke, educating them, physical and psychological health management, functional health management, all of these things rely on screening, education, counseling, discussion, goal setting, right? So how do we do this work without the ability to converse? So I would like to say that it's all our roles to reduce that barrier of aphasia. So let's start with a conversation. It's from our e-learning that I'm going to tell you about, which is free for anybody to take. And this conversation is someone with aphasia named Christine, who's being discharged from hospital. She's waiting with her husband, Vincent, for the information, and the healthcare worker is going to give it to them. And I just want you to note, without supportive tools here, was this a respectful way kind of to give Christine this information? And was there any attempt to direct the conversation to her?
Hi, I'm Judy. I'm a member of the healthcare team. I understand you're going to be going home today.
Yes, we are. Very much looking forward to that.
Oh, that's great. So I know you've had a stroke and you're going to be going home on some new medications. The medications that your wife's going to be going home on are very important. They have to be taken exactly as they're prescribed, and they have to be taken every day. And for now, the doctors are saying that these medications have to be taken for the foreseeable future. There's 2 new medications. One of them is an anticoagulant. It's used to keep the blood thin and prevent future strokes. And the second medication is used to control her heart rate. Again, it's to prevent future strokes. I've brought in some information sheets here that I'm going to give you if you have any questions.
Okay, thank you. I'm sure I will have some.
Okay, great. Thank you.
Okay, so well-meaning information that the healthcare worker wanted the patient to know. She starts with Christine, but then turns to the husband. The conversation is quick. It's full of jargon. It's a steady stream of information. And she gives the medication sheets to the husband and asks if he has any questions. So in my take in this, Christine looks kind of confused and frankly a bit aggravated. And how is Christine supposed to take ownership of understanding her meds without truly understanding what was passed? So I would say that there's a different mindset to adopt, and that communication access matters. And for people with aphasia who are transitioning home, they really need that. So this is one of the pages that is free from our resource, What is Aphasia? And I use this page a lot because if I can do nothing else, even if I have to speak very quickly with someone with aphasia and their family, I want to communicate my understanding that aphasia does not take away competence or the ability, and also that I want to assert the person with aphasia can make their own decisions about their care. So when I use this, it often brings a lot of nodding. It brings a relief that I get it. So what we're talking about really is making your services accessible for people with aphasia, and treating the person as a competent adult and restoring dignity really in terms of how they're cared for. So communication access is the right of people with communication challenges to receive barrier-free service and to get and give their own information and participate in decisions in their own care. But unlike physical accessibility, where it's not simple either, but the ability to install a ramp, the ability to install an elevator or give a wheelchair, that is powerful. And communication access can't work like that. Actually, what has to happen is each of us needs to become a communication ramp. And the healthcare provider then needs to learn a new set of skills to use in day-to-day interactions with people with aphasia. So I'm just going to briefly go over the basic idea about supported conversation for adults with aphasia, and then direct you to our e-learning. So it is for people who know more than they can say. There are two main pillars to supported conversation. One is acknowledging competence, which is interacting in ways that acknowledge the person, their inherent competence, and helps to actually change the experience of aphasia for people. So they experience their aphasia differently because of the way that we've acknowledged them. The second big pillar in supported conversation is using a set of tools to give and get accurate information with someone with aphasia, okay? To understand what they're thinking and being able to help them understand what you're telling them. So when we use this as a framework for conversation, then the healthcare worker learns to provide conversation support. So we have to do things differently. We need to be active on a few levels. And one of them is that acknowledging competence that I just talked about. Asking ourselves, is the person being treated like a respected adult? And doing simple things that increase these feelings of competence in the person with aphasia. The second big piece in revealing competence is there's three sort of skills that we learn. One is getting the message in more clearly so they have a better chance of understanding. Getting the message out so that the person is enabled to express their ideas and ask their questions, and then verifying that we have understood them. We take the responsibility on ourselves to say that I want to check that I understand and also that they've understood you. So here's a visual. We put it all together in a toolkit. And so using the toolkit, acknowledging competence is kind of like the handle of this bag. It holds things all together. Revealing competence, we think of in, out, and verify, and a whole bag of different tools, some of them visual, some of them in the way that you talk to people, some of them in the way that you show people things by gesturing and using pictures. And this whole toolkit all together, you can learn to use quite effectively with people with aphasia and also other communication difficulties. So I'm going to show you take two from the e-learning where Judy has got a few tools now that she's going to use with Christine. And I just want you to note, what are the differences you see in how this interaction takes place?
I understand that you're going to be going home on some new medications. The doctor's prescribed 2 new medications. The first medication, it's for your heart. And it's to make sure that your heart is beating in a regular way. We don't want to have things too fast or irregular. That wouldn't be good. The second medication has to do with your blood and the way your blood flows through your arteries. Want it to flow through. We don't want any clots. That wouldn't be good. We want to prevent future strokes. Both medications are important, and you have to take them exactly as they're prescribed. The medications have to be taken every day, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and Sunday. Every day you have to take those pills. And for now, the doctors are saying that you have to take the pills always for the foreseeable future, right? That you're going to be taking these pills for a long time to come.
Okay, so you may have noticed some subtle changes in the way that Judy's talking, slightly slower, a few more pauses, simpler language, as well as a bit more repetition. Noticing maybe how she acknowledges Christine by speaking directly to her with the husband still in the conversation. And then that use of visuals to be able to support the understanding. So these are small changes that anybody can learn to do. And if we look at it, this explanation actually took about 30 seconds longer than the first one did. But the effect on Christine being engaged, I hope you could see even in a small snippet like this, and taking charge of her own medication and understanding that and how important that would be in terms of independence and feeling like yourself again. So one tool, I was asked to kind of provide some things that you could start tomorrow. So a tool that I think you could use tomorrow comes under acknowledging competence. It's so important. And being able to directly acknowledge with different phrases that the person has a communication difficulty, but it has not affected the way that they can share their information with you. So we use phrases like, I know you know what you want to say. I can see it's frustrating. You have the right idea, but it's hard to get it out. So again, using that page from What is Aphasia as your visual, the reaction again that we get is one of relief and that sharing of the burden. I become a partner with you. The aphasia is between the two of us. It's no longer all up to you. And I know that you've got the idea in your mind. It's hard to communicate. This is a huge tool that you could start tomorrow if you wanted to. The indirectly acknowledging competence, these, you can learn more about these in our e-learning, but just some ideas again for tomorrow is developing the ability to talk naturally with a bit more of a slow rate. We tend to speak very fast in healthcare, and learning to speak simply without the medical jargon, talking about complex topics with people, not sort of dumbing it down for them, but learning how to speak more simply about it. Directing questions to the person with aphasia rather than to the family. And most importantly, tomorrow, you could make sure that you ask permission before speaking to somebody with the person with aphasia. So you have a page in the handouts that I provided for today called For Busy Healthcare Professionals. And it's just a visual used, even if you didn't have enough time. You're really short on time, as all of us are, and you do need to ask a lot of questions of the family. Its ability to say, I know you have aphasia, and it makes it hard. And I'm asking, it's in the short amount of time that I have, is it okay if I ask some questions to the family? I always do this, and it always kind of at least restores, again, that ability that you know that they know. So in terms of our e-learning, the idea in medical interactions is talking to them in ways that they can understand and supporting them to give their answers. Explicitly asking the person with aphasia if they have questions for you, checking to make sure you've understood, and providing accessible written information, which when you look at the e-learning, it might mean writing down a few of the key ideas on a piece of paper having a visual or a pictographic resource to support the information. So the e-learning is 45 minutes on our website. And also there's the ability to take what we call basic supported conversation training. And that is speech therapists who've come and been trained by us. They're now in your region as well. And they provide sort of a modified basic SCA training. So I know Sue was saying there's a number of, we call them train the trainers. They've trained with us and they can train you. We also offer a more comprehensive training, a 2-day training that I think probably some people on this call have taken. So if you want to check that out on our website. Couple more things before I finish up is in considering to return to home. I think one of the big things is for all of us as healthcare workers to be able to what we call out the aphasia. So describe it in a way that it's not one person's responsibility. And remind family that aphasia is a communication problem, not a thinking problem. So to be able to reinforce with the right support, things can look different, right? So our What is Aphasia booklet is really, really helpful in this regard. I think we need to be able to ask about mental health and well-being, each in our own areas, right, of healthcare, to be able to ask about loneliness and sadness and depression in people with aphasia, being able to check in about social connectedness and relationship health, given the impact of the aphasia, being able to check in about risk and safety and vulnerability in the home. How do they call for help inside their home? How does somebody who lives alone with aphasia make sure that they're safe? And then how are they able to follow up on the rehab plans they've been given? Sometimes they need advocacy from us. Do they live alone? Do they need, and even do the people in their lives know the difference between supporting the conversation and taking over or making decisions for them? I've also provided in the handouts the idea of a communication access planning framework. So a bit of a framework around what are the kind of conversations we should be having. So this is what you've got a copy of. It is really a stab at what are the topics that need to be covered? Well, usually these should be covered before discharge from hospital, but in reality, these needs are really revealed over time with people with aphasia. And so maybe having a look at this planner as, which person on the team looks at the basic health needs, safety, and medical communication? Who looks at the activities that they want to be back to, the social connections and how to stay connected? Who looks at that return to independence? One of the things I thought of with driving is, in our experience, families are really reluctant due to the aphasia and that added sort of worry level of somebody returning to driving. So the family can be additionally protective and kind of take over decision-making in this area. So are we having those conversations with the family and the person with aphasia? And lastly, the community integration. So, how are they connected back into their community? What's the barrier? I have a couple ideas here on how to direct the family to some conversation partnering. So in your own way, being able to understand the power of the conversation partner and being able to kind of explain these concepts in your own words. We call it a language of hope. It's a bit of a language of hope for re-engagement. And I think that some of the material in our family pamphlet may help you. So we have a family pamphlet that you can download from our website, and also a companion video for the family. So it's a 15-minute sort of mini education and awareness on aphasia, what it looks like, what it feels like, and some basic tips to support conversation at home, to acknowledge competence, and with kind of even exact wordings. These are some of the things you could say to your family member with aphasia. As we've been talking about, we want to be able to connect people to mental health support. It's a real big push at least in aphasia care. And so we have one thing is for the family, actually. It's called Path to Resilience, and it's on 2 times a year online through the Aphasia Institute. You can go to our website for information on that. And it's for the care partners, offering some tools to their well-being. I think that it's on the idea that, you put your oxygen mask on first before you can care for somebody else. And so it's a real recognition that it is difficult. And so we'd like to provide some support in that area. I think it's important in all areas of Ontario to find the social workers and counselors that we say sort of speak aphasia, and encourage this set of really important colleagues of ours to learn this skill set. I think even from Teresa's keynote from this morning, how do we provide coping strategies when conversation is such a big part of that delivery of that care, of that service? And even to understand that you in your role are a part of the necessary support. You offer a healing conversation, if we want to call it that, even in 5 to 10 minutes of using something where you ask somebody how they're doing and you support the emotions. You just listen. You also have this feelings page in your packet from today. How are you feeling? And people can indicate even just by pointing to the pictures. The last thing I'll talk about is the idea of giving hope and giving connection. And so looking at that hope language in our What is Aphasia booklet, there's a couple pages there on hope, and it has to do with learning to speak aphasia. I think that a big part coming out of hospital that we find anyways is that sometimes people have been given that you've got 6 months, you've got 1 year, and then no more recovery. And so, I put the reference here, a leading aphasiologist in Australia had a YouTube presentation on let's ban this flattening curve because people can make changes going forward for the rest of their lives. And so it really depends on what the person chooses to do and engage in their life that makes things better. I think that offering and encouraging connections. So I've got a couple ideas there. We've got some online resources, the National Aphasia Association or Aphasia Recovery Connection. Both of these in the States have social media places where family and people with aphasia can connect into communities, as well as any online or in-person groups in your community. One piece of information that I was given before I came to this talk is that the Aphasia Institute is currently considering our ability to open our online group conversation to people in Northern Ontario. So it's really preliminary, but I wanted to put that out there. I really hope something might be able to happen that way. But to have a list of the private services in your community and those intensive programs for people with aphasia is important. And even the idea of using some of the language that you'll find in our materials, encouraging life is larger, life can be bigger, and aphasia can feel smaller. So I hope that you'll be looking at some of these resources which are free for you to download. So we have Talking About, which is a series that looks at different topics that are supported in picture material, as well as that What is Aphasia. You have those 5 pages I gave you from today. It's got feelings, it's got a page on medical professionals and future sort of medical workup and tests so that people can understand that by just looking at the pictures with you. And also that any of these resources that we have, you're free to photocopy pages for people to take home, because part of it is for them to look at it when they get home and talk with their families as well. Last thing is this is a paid series, paid resources, but there is a whole series for many different kinds of professionals. And my takeaway here is that the whole book itself might be overwhelming. There's a lot in there, but you can take a section. You can decide to try to use a page, one page with someone, and take it in pieces. And that way your patients learn how to use it as well as you learn how to use it little by little. So I hope you'll come and visit us. Here's our website. We have a section for people with aphasia. We have a section for family and friends and a healthcare provider section. And so I'd just like to thank you very much for your time and attention today. I've really enjoyed speaking about this, and I'd love to hear any questions that you have.
Thank you, Leanne. It was a great talk. Just as a little comment on your conversation resources that cost money, the Stroke Network here in Northeastern Ontario will sometimes pay for resources for our healthcare providers across our regions. So for example, when the Picto rings came out, we sent out an email and asked who wanted one, and we purchased a bunch and had them sent across. Sometimes we purchase these booklets like talking to your doctor, talking to your OT. So people can keep us in mind if there's something that they're missing, but I feel like we're well resourced across Northeastern Ontario. So that's good to know. Please post any questions in the chat and scan the evaluation. I wanted to ask a couple of things. What are some of the adaptations or strategies that you have suggested for people that are going home to live alone? Are there a few particular ones that you tend to utilize every time?
Yeah, I mean, making sure the basics would be that they've got a way to call for help if something happened, right? I think our OT colleagues are handling that. But I think it's often also, I think without the ability to have a deeper conversation about what they need, we sometimes don't know what they are worried about, right? Living alone. And it might be being able to manage their appointments, or it might be, right? Because everything's in writing, everything's quick on the phone. These are hard things for them to do. So unless we have that conversation where we ask them to help us identify and then become that advocate and work in those gaps, in those spaces, we don't know what it is that would make the biggest difference for them.
Right. Okay. And then I just wondered, does the Aphasia Institute offer anything for people with aphasia in terms of online courses, online peer support, online groups, anything like that?
Yeah, so
Or is it local?
yeah, the peer support, I would say to look at those US sources I gave for online peer support. The Aphasia Institute doesn't have anything like that right now. But as I said, it was kind of like, I wonder if we have a strong online group program now and in person, and we're kind of having these initial conversations. Where could our online reach go? And that would be an opportunity for group participation.
Okay. Somebody just asked in the chat, if they're home alone and they have to call 911, is there a way they can do that? Is there a little trick for that?
You know what? That is a very good question. I don't have an answer for that one. If they have to call 911 without being able to say something, to speak. I don't know if anybody on this
check in with the
knows.
occupational therapists. I don't know if they could have a recording that they could play from their phone, right? Say, I need help, I can't speak.
For sure. I mean, there's a lot of really low cost apps now. So Speech Assistant is one that I use all the time. It's really low cost, and you can program in, I need help. That is a very good point. You thought of it for me. But yeah, that
somebody is also saying technology can be used to assist, for example, pre-recorded messages or text to speech, those sorts of things. So check with your speech therapists, maybe your OTs, and see what kind of options they might have in their catalog of things for people with aphasia.
Yeah,
There's also the Lifeline call button, right? And someone is also putting in the chat that Love You Brain is a US-based virtual community for people and families with ABI or TBI, and this person utilized that themselves and thought it was quite good. So there's another something that maybe people could try out.
Absolutely. Thank you for putting that in there.
All right, so that's all our time for today, Leanne. We really appreciate that you spent time speaking to us today, that you were with us today, sharing your information. And if people need more resources from the Aphasia Institute, please reach out to me at the Stroke Network and we can see what we can do. Thank you very much, Leanne.
Thank you.